Hello, everyone. I'd like to welcome you all to the May 2025 session of OT Echo. I'm Andonis Bouritsas, joining from Thessaloniki, Greece, and I'll be your host for today's meeting with the wonderful support of Kelsey Sullivan and our invaluable facilitators. It's May 8th, 2025, and today we are honored to welcome Dr. Nyarie Munambah joining us from Namibia, who will be presenting on promoting play with children who have a chronic illness in a low-resource setting. Before we begin, just a quick reminder, to receive a certificate of attendance, you must complete both the pre and post-test. Kelsey will post the link to the pre-test in the chat in case you hadn't had the chance to complete it yet. She'll also provide us with a post-test link during the final 5 minutes of the session. Make sure you check them both out. Please keep yourself muted during the presentation and feel free to type any questions in the chat box. Dr. Nyarie will first deliver a 30-minute presentation, followed by a case study. After the case study is presented, we'll break into small groups where our facilitators will guide discussion and help answer the related questions. While in your breakout rooms, please keep your cameras and microphones on and actively participate. There are no right or wrong answers. We are all here to share knowledge, interact, and learn from each other. After the breakout rooms, we'll reconvene in the main room to continue the discussion and share key insights. Thank you all for taking time out of your day to join us and continue your learning with OT Echo. There's no time to waste, so let's get started. Please join me in welcoming Dr. Nyarie. Thank you so much for being with us today.
Thank you so much. I've just shared my screen. Can we see it?
Sure.
Okay. Hello, everyone. Thank you so much for joining the session today. We are going to talk about promoting play of children with chronic illness from a low-resource setting. As you heard from the introduction, I'm from Zimbabwe, but I'm working in Namibia currently. So we're going to share our story from a low-resource setting, the work that we have done and what we thought is actually working. And we'll hopefully in the discussions, we'll also hear from you guys what you think is working, what you think should be added, and everything. So we are going to have discussions at the end. So we hope that by the end of this session, we'll actually describe the factors that influence play, the principles for promoting play, and techniques or strategies that can be used to promote play of children with chronic illness living in a low-resource setting. As an introduction, I think globally we actually are aware that there is an increase in the numbers of children with chronic illnesses. Unfortunately, in low-resource settings, the statistics are usually not available. But I think we can know that there is ADHD, there's an increase in number of children with autism, cancer is under high, mental health challenges, and even neurological disorders such as cerebral palsy is very high. And for this discussion, the definition that we are going to use for chronic illness is that chronic illness are referred to as children who have or are at risk of a chronic physical, developmental, behavioral, or emotional condition and who require health and health-related services to amount that is beyond required by typically developing children. So these children with chronic illness are kind of children who are kind of have more time in the hospital, they have frequent hospital admissions, they have poor health status, and most likely they have low reduced physical activities. So this actually put them at risk of mental and behavioral problems. They experience challenges in engaging and participating in occupations such as the occupation of learning, the occupation of play. So as occupational therapists, we need to intervene in this population. Actually, early intervention is what we advocate for. And as occupational therapists, what we normally use when we're working with children is play. We use play-based interventions with children. In most cases, because play is fun, play is enjoyable, it's something that we actually help children. It's something that children do every day. So we normally use play as a means to achieve certain outcomes. Outcomes like range of motion, outcomes like muscle strength. We use play as a means to actually achieve those outcomes. However, in other instances, we actually know that play is an opportunity for children to learn survival skills, to build resilience towards maybe adverse life events, and actually to develop self-efficacy. So it's something that they actually need to engage in so that they can actually develop skills even for adulthood. So play, we have to see it as an end, something that they have to engage in. And that using play as an end is something that we have to actually explore and promote in our everyday role as an occupational therapist. So the definition for play that we're going to use today comes from Skadi and Bandy, who says that play is a transaction with the environment that is intrinsically motivated, internally controlled, and free from the constraints of reality. So as we promote play as an end, that is going to be our focus for today's session. And to understand play more, I've used the model of children's play. This model was developed by Cooper in 2000, and he was working with children with victims of child abuse. So when the model of children's play talks about three components that you need to look at when you are promoting play of children. And number one is that they look at the individual play style of the child. So they say the child has got an individual play style, and that includes the internal control, freedom to suspend reality, intrinsic motivation, and framing. And then also we have to look at the developmental skills of the child. And the developmental skills include cognitive play skills, physical play skills, and social play skills. So if a child has to engage in play, there should be a certain level of cognitive level play skills that they have so that they can engage in a certain type of play. Although they have to have some physical skills so that they can engage in a certain type of play, and as well as communication and social skills that they have to have so that they can engage in play. And then the last component that we need to consider when we're looking at play is the environment. Usually the environment plays a big role in shaping the way children engage and participate in play. We are going to see how these components relate as we go on further. So we actually conducted one systematic review where we're looking at play of children with special healthcare needs. And we looked at children, and from the systematic review, with articles that looked at play of children with ADHD, with cerebral palsy and DCD, and then also developmental delays and other disabilities. And from that systematic review, we found that children with chronic illness, they spend more time
I think we're facing some difficulties with the internet connection. We'll just have to give a little time to Dr. Nyarie.
playing alone.
I'm sorry for the interruption. I will email and check in on her. Hopefully she'll be right back. Thank you, everybody, for your understanding.
We got your back.
Oh, thank you. I don't know why the network is actually trying to play me today. But anyway, we can go ahead. So I was saying the children with chronic illnesses, they actually spend more time just looking at other children playing, or they're more passive most times. And we also did another study where we looked at children who have HIV, who are HIV positive. And those children, we compared them with typically developing children. So we observed children playing indoors, children with HIV playing indoors and then playing outdoors, and also typically developing children playing indoors then outdoors. So the blue line on top shows typically developing children. Yes, the play is generally lower indoors, but it's even more higher outdoors for typically developing children. But for children with HIV and AIDS, their play is actually higher indoors. And then when they go outdoors, it's actually lower. They kind of engage less in play. And that actually shows that maybe there's a place for us as OTs to actually intervene by structuring the environment, by working on the environment so that it can be supportive to play. And then the last study that I'm going to talk about is the study we did with caregivers. And we're looking at their perspectives of play. And some of the insights from the caregivers showed that they are incapacitated by poverty. So caregivers said their priority is actually survival. So they can't think of buying a toy when there's no food, or they can't think of actually spending time with the child when they have to be working so that they can get food on the table. So priority is mainly on survival than anything else. And some caregivers talked about Ubuntu is no more, where they said there are no more safe spaces for children to play. So the community spaces where children used to play is now maybe hubs for crimes or dump sites, and those spaces are no longer safe for the children to play. And they end up playing indoors or not actually playing at all. One interesting finding is that we found out is that caregivers, when you talk about toys, they think about things that you have to buy. They think about things that you have to get from the shop. And then it's a costly for them and they are not ready to actually engage. So we then have to change and say play things, like things that the parents can actually play with. Play things, not toys, so that they can actually relate. And also caregivers talked about being overprotective. They will not let anyone touch their child, or they cannot leave their child with anyone else because they want to protect the child. They feel the child, if they let them to play, they can actually worsen the condition, or they can actually might not actually engage in play. So they're kind of overprotective to their children. But all these factors in the environment actually limit play as an occupation for children, especially, and it's even worse when we are talking about children with chronic illnesses. And so I go on to the principles of promoting play, maybe play-based interventions. And I'll talk about, as we have talked about, play being not a priority. Yes, we need to advocate for more play opportunities as occupational therapists, and we need to raise awareness about the importance of play, especially for children with chronic illnesses. Because normally people, when they think about chronic illness, they just think about survival and not actually promoting play as a component that is important for these children. We ensure food nourishment. I'll talk more about that. And then we need to complement existing treatment programs. In lots of settings, there are so many programs for treating chronic conditions like a diabetes clinic, an HIV clinic, and all those clinics. And if we complement those existing programs and work with them, we can actually promote play. Then we need to actually include culturally sensitive practices. When we're working with mothers, we often ask them, the caregivers, to reflect on how they used to play. And you see how they actually then relate to the play-based intervention, or even when training them, and you ask about how they used to play and the traditional games and the play things. That reflection helps them to actually understand more how to promote play of children, promote play of children, even including children with chronic illness. So the other principles is that we need to make sure that there is social interaction. So we need to include peers, and then there's also physical and social active involvement of the child and the caregivers as well. I will just rush on to talk about the strategies that we can use to promote play of children. Number one is caregiver education. There's always need to train caregivers on the importance of play and the strategies to promote play, how to make low-cost play things, and actually about also taking care of themselves, because at times then they don't have energy or they are going through a lot that they can actually not engage with the children. So we also have to teach them how to take care of themselves so that they can take care of the child. The second strategy we can use is therapist modeling, where the therapist, you act out or you showcase this desired play actions, and then you guide the child to follow you. So you can dress up, you can play, and make sure that and allow the child to follow your play. Then the third one is video modeling, which is observational learning. So you can watch a video with the child and then allow the child to imitate the behaviors from the model that you'll be watching. And video modeling can be actually adapted depending on our settings. So you can actually be projecting it, you can watch it from the TV, from your phone, or it can be short clips, long clips, depending on how your structure is and how you want to actually grade the play intervention. One thing that is also very important is decentering. It's kind of a play that fosters the ability for the child to understand different perspectives, emotions, and own thoughts. Remember, these children, they are kind of overprotected, and at times they don't understand other people's emotions. So we need to actually allow play that allows that kind of thing. Pretend play and play in groups will actually help the child to develop those skills. And that's very important if you're working with children with chronic illness, because they're always pampered, so we need that opportunity as well. And the fifth thing, strategy that we can use is peer modeling. When we do peer modeling, we can actually allow them to play in groups, and then the peers, they will learn from their peers, they learn how to play even in groups. So play groups can actually be important. And the sixth thing is creating safe places for play. In low resource setting, if you're talking to the policymakers and you say we need a play space, they'll think about a swing, the slide, but at times those things are not clearly designed to allow children to actually feel safe and comfortable and secure when they're on that playground. So we need to actually advocate for safe spaces. We need to talk about lighting and also advise on the playthings that can be included that are kind of stimulating to the children and allow the children to actually play, but not a danger to the children. Then we talk about toys, the playthings. We can talk about low-cost toys. We can talk about recycling toys, or even homemade toys. You can use different words depending on the caregivers that you are working with, because if you talk about low-cost toys, they think it's useless. It's no value because it's low cost. But what exactly are we meaning? Are we talking about just playthings or homemade toys that we can use? So you need to be very innovative in your wording also when you're talking to caregivers, and also talk about the toys or playthings that they can relate to in their context. And then nutritional supplement is very important, especially for children with chronic illnesses, because usually most of them lack financial means and to actually get healthy food. And we all know that not consuming sufficient healthy food may lead to a faster progression of the health condition and maybe reduce the rate of recovery for the child. So it can actually affect the play-based intervention in some way. So play, we need when we are when we are engaging in a play-based intervention, it's very important to look at food not as a motivator, but as a necessity for the progress and development of a child. No one would want to play when they're hungry. So I think we also need to consider that. Those are the strategies that I have. And as I approach the end of my presentation, I'll talk about maybe some of the things that we can consider. We need to consider collaboration with other health service, other existing services. So when you're working, especially in the communities or in settings where there are other services being offered, you need to identify key stakeholders and engage them on how you can actually set up a play-based intervention for children with chronic illness. And we need to complement existing services that are already there. We can think also about raising awareness, usually with the World Day commemorations, because I think more resource settings and we cannot do these play-based interventions regularly. So just targeting World Day commemorations and raising awareness and actually engaging in that play would actually be helpful. And delivery of the play-based interventions depends on the context, but collaboration is very key. And monitoring and evaluation of progress of the children is very important, and progress of the project as well is very important. This helps you to improve the intervention as you go. And lastly, we need to consider working with individuals and collective together. Either at one point you have to be one-on-one with one child, but you can also do group or collective interventions for the group. And that's all we can actually do. So that's the end of my presentation. Okay. So I go on to share my case. I'm not sure how our time is, but we can have more time for discussions as we go. Can people? So the case is Jen is a 6-year-old girl who has been infected with HIV/AIDS and has been in and out of hospital for some time. And Jen's mother is young, 22-year-old, and struggles to take care of Jen. Jen's father refused to take responsibility of the pregnancy and has never shown any support to Jane and her mother. Jane receives monthly supply of antiretroviral medication at the hospital where you work as a senior occupational therapist. At this hospital, many children with HIV and AIDS also do come for services. So the questions that we are going to be discussing are, number one, what factors are likely to limit Jen's engagement and participation in play? Number two, which techniques would you use to promote Jen's play? And number three, you decide to establish a play group for children attending the clinic for HIV/AIDS services. What play principles would you consider?
Thank you very much. Kelsey, shall we proceed with the breakout rooms?
Yes, that sounds great. Everybody remember, please turn your cameras on and speak. Thank you so much. Okay, welcome back, everybody. Before we begin, just remember to mute your microphone if you are not speaking. And then if you have anything else that you would like to say that maybe a facilitator does not mention, please feel free to put that in the chat as well. We are now going to go over our questions for the case study. I will read the first one aloud, and then I will call on each of the facilitators to answer the question. So the first question was, what factors are likely to limit Jane's engagement and participation in play? And the first person is Timothy. Do you mind sharing what your group said?
Well, thanks so much, Kelsey. Kelsey. Yeah. The factors we discussed first was nutrition. One of the things was nutrition. So, if at all this Jane is not having proper diet, she will be affected. Then the other thing is stigma. So, stigma in HIV patients is quite much, and it affects their engagement in different play activities. Then we looked at the side effects of this disease, for example, fatigue, diarrhea, the skin rashes, also have a way they affect the engagement in play. Then the play opportunities. It's if at all they are not given those opportunities, then it's very hard to engage. Some of them can be locked away. Then we talked about the father figure in her life. So Jane might be limited due to not having that love from the parents, like the father or the mother might also be thinking about other things, like the psychological effects. Yeah. Then since she's having a single mother, she might be busy looking for maybe what to eat, what to do, and then she won't be having much time for Jane. That was our group's discussion.
That was quite a comprehensive list. I will jump to Eunice. Did your group get anything else?
Oh, yes, we did. And I think I was quite aligned with Timothy's group. So we have fatigue, and we also have lack of toys because her mom, being a single mom, affording some of the toys is going to be a challenge. And then also lack of a safe place for Jen to be able to play. And then also stigma. Stigma is also a factor that is going to affect Jen, basically because coming from the community, sometimes these children usually face a lot of stigma. So yeah, basically that's it that we had from our group. Thank you.
Thank you so much. And then we're going to have one more facilitator answer this question. Ms. Manzo, did your group get to this?
We did, and I guess our answers marry with the rest. We talked about, yes, among other things, the fatigue was generally the comorbidities and how they would mean that she's in and out of hospital and not exactly around other children. And then, of course, the young mother's priorities might be different, considering a single parenthood and all that. And then the home situation, an absent father, probably economic situation and blah, 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 would affect her view of self. So her self-esteem would affect how she socially presents in play situations.
Thank you so much for those insights. Nyarie, before we move on, is there anything else you'd like to add to this question?
I think all the answers my group had have already been covered.
Okay, perfect. So we are going to go on to the next question. This one is, which techniques would you use to promote Jane's play? And then Evidence, do you mind sharing what your group said?
Okay, we talked about modeling, using modeling, and also positive reinforcement, and increasing playthings toys that are available in the community or around, and also educating parents to engage in play, or if there is no time to engage in play, creating a schedule that would be suitable for them to engage in play, and also energy conservation technique, and referring to a nutritionist. And lastly, we talked about group play session to help improve social interaction.
Thank you so much. Tobiola, did your group get to question number 2?
Yeah, we talked about modeling play. We talked about modeling role play. We talked about role play where we practice and other children get to, show the child what to do. Yeah, we talked about modeling, and also we talked about educating the caregivers about what and what to do concerning this. And we also talked about group therapy, where other children come into the session to stay alongside this child and explain how HIV/AIDS is not the end of the world. So even the children, not just the adults alone, now that the children will be able to know that okay, I can play with this person, I can play with that person in a safe way. Yeah, that's it.
Thank you so much. Budika, did your group get to question number 2?
Yeah, of course. Thank you. So we have discussed about the storytelling and the caregiver education, also the peer groups interaction, and also the members suggest the hospital offers some play opportunities to Janes to engage the play and use of low toys, and also the support group of HIV women which benefit for the Jane's mother. Yeah, these factors we have discussed.
Okay, thank you so much. We are going to go to our third and final question. You decide to establish a play group for children attending the clinic for HIV/AIDS services. What play principles would you consider? Mary, do you mind sharing what your group got?
So I think all the principles we had learned applied, starting with child-centered approach, having the group have the children themselves leading with play and play activities, choosing their interesting activities to engage in. We had also encouraging creativity, exploration for the children. Also, we had active caregiver involvement. That means the caregivers need to learn about play and also be your support as an OT in the group sessions. And also we had advocacy for more play opportunities. So for example, if these children were coming for HIV/AIDS services, maybe once a month, then you as an OT need to create more time for them to come and engage in play together in the hospital, apart from when they're coming for their services. So you're creating more opportunities for them. And then we had awareness campaigns around the community so that we can deal with the stigma, and the community is able to understand HIV, and apart from that, the importance of play for these children. And then we had inclusion of culturally sensitive practices, because they are familiar with some of the songs, some of the activities from the community or from their homes, then making sure that when you're creating this group, you have these activities from home, from their culture, whatever they understand. If it's toys that are from their culture, they are also included so that it's a familiar ground for them.
Thank you so much, Mary. And then we'll just ask one more group. Timothy, if you don't mind, we'll round back up to you.
Oh, yes, thank you so much. So here we also talked about, adding on what Mary's just said. So we talked also about counseling, engaging the family through counseling, letting the mother know how to handle the situation, engaging the father so that he can be in the child's life. Then promoting medication. If at all they are taking their antiretroviral medications, so they will be able to get more energy and participate in these activities. Then we also discussed something about the energy conservation, whereby stigma brings about having low energy, and then other opportunistic diseases that come along. So the body needs to conserve a lot of energy for play. So that would be a very good principle too. Then the nutrition. So providing better nutrition with enough food values or good energy supplements would be able to enable this child to engage more in different activities and play groups. Then we also looked about the caregivers. So the kind of person you live with a child is very important so that they can promote more play and engagement in different activities. Yes, that's how we went about it.
Okay. Thank you so much, Timothy, for that. Seems like everybody had very productive conversations. I'm just going to quickly ask Nyarie, our presenter, do you have anything else you would like to add?
Thank you so much. I have nothing more to add. And I thank you all for engaging. And we got also quite fruitful feedback from your group discussions. Thank you.
Perfect. Thank you so much. Everybody, I have sent the link in the chat. Please complete your post assessment as soon as possible. If you don't have time to finish it right now, please copy and paste that link just somewhere that you have it for later. Also, you can get all of the recordings at the link that I also put in the chat. And then if you have any questions, please feel free to email me. If there's any questions regarding certificates, sometimes it comes from you might have not completed the pre-survey prior to the session, or sometimes we're having issues with OT Echo properly logging people who have attended. So just make sure that you're always joining directly through your OT Echo site. If there's nothing else, that'll be all for today. Thank you so much.
Thank you.
Thank you.
Thank you. Bye.
Thank you.